Are you all ready for me to start? No? I can't hear.
Whenever you're ready.
Okay, I'm sorry. Thank you. Okay, let's write this first. Good morning and welcome to the April 26th meeting of the Quality Assurance Task Force Virtual Workshop. I'd like to call the meeting to order. My name is Marilyn Baldwin and I'll be chairing the meeting today. At this time, I'd like to ask Mr. Wayne Olson to lead us in the Pledge of Allegiance. Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you, Mr. Olson. Today's meeting was advertised on MetroPlan Orlando's website and social media, as well as through targeted emails. This is our first in-person meeting in more than 2 years, and while we have Zoomed in-person meetings, we are continuing to have the virtual option available for the public who wish to observe the meeting or make public comments. Members, masks are optional today. I encourage you to do whatever is most comfortable for you. It's been a while since we've been in this room, so I also remind you to be sure to activate your microphones before you start talking and deactivate it when you finish. Members of the public, we will still be able to participate virtually, and we encourage them to do that. There are 2 public comment points in the meeting. Members of the public attending in person who want to speak need to fill out a comment card and give it to Lisa. Those attending virtually who want to speak will use the raise hand feature on the Zoom. Screen. If attending by phone, you can hit *9 to raise your hand and request to be recognized. When you're called, your microphone will be temporarily unmuted by staff and will ask you to state your name and contact information for the record. Any public comments received by email or phone message before the meeting will be read into the record. Before we move to public comments, I'd like to ask Ms. Lisa Smith to call the roll to ensure that a quorum is present. Ms. Smith, you're recognized.
Yes, good morning. I'll ask all committee members to please keep your microphones off until call. Once your name is called, activate your microphone, say here or present, and then please turn your microphone back off. Baldwin,
Present?
Berry, Campbell,
Present.
Hickling,
Present.
Milia,
Present.
Olson,
Here.
Zabritsky.
Present.
Madam Chair, that concludes the roll call, and we do have a quorum.
Thank you, Lisa. Next, Mrs. Whittington will review the agenda. Mrs. Whittington, you're recognized.
Good morning, Madam Chair and committee members and everyone who's joining us online. We are glad to have you all back today in person. I also want to call attention to this committee and let you know that we have had 2 resignations that have resulted from employment changes. Chad Ballard, who represented the medical community, and Ms. Crystal Ford, who was a non-voting member on the LCB representing Orange County's EMS. They've both taken new jobs, and with those changes, they are no longer eligible to serve on the LCB. and by virtue of that, ineligible to serve on the QATF. So staff will be working over the next couple of months to make sure that we get those seats filled. We are joined this morning by Ms. Ms. Charlotte Campbell, your at-large alternate. She's joining us today. Her orientation was conducted on March 30th, and so we're glad to have her here, and she's here by virtue of your vote at the February meeting. And we're also joined by Mr. Adam Zabritsky, who has been a longtime member on the TDLCB, but he has now joined the Quality Assurance Task Force. As for our agenda, item 7D, the presenter is going to be Ms. Laura Menz. She will be presenting on behalf of Lynx. Madam Chair, this concludes my announcements this morning, and we are prepared to move forward with the rest of the agenda as printed.
Thank you, Mrs. Whittington. Let's move on to public comments on action items. We will now hear from the public wishing to make comments on any of our 4 action items before us today. And we ask that you please provide your name, address for the record, and please hold your comments to 2 minutes or less. If any member of the public wishes to comment and you're joining us virtually, please use the raised hand function and you'll be recognized, or *9 on your phone keyboard, and we'll send you a prompt to unmute your mic. Do we have anyone joining us virtually who would like to make a comment?
Madam Chair, there are no hands raised on the virtual side of the meeting.
All right. Do we have any members of the public attending in person that would like to make a comment?
We have not received any speaker cards.
All right, very good. Were there any written or phone comments that were submitted before the meeting?
Madam Chair, we did not receive any comments either on the phone or email.
Okay. I'm going to call on Mrs. Whittington to present the next item.
Thank you, Madam Chair. As mentioned just a moment ago, we have a vacancy that occurred as a result of Crystal Ford resigning from the QATF and the TDLCB. Crystal has served as the vice chair for this committee, and we would need to take a motion or nomination to fill the vice chair role, and that vice chair would serve the remainder of Ms. Ford's term and serve in the absence of the chair. So with that, Madam Chair, if there is a nomination from the floor, I'm happy to take that.
I'd like to make a motion to nominate Wayne Olson.
Okay. Mr. Wayne Olson has been nominated. Are there any other nominees?
Okay, we would need a
Are
second.
there any other
Is-
nominations? I've known Mr. Olson for quite a while, and he's served very capably on our board, and I believe he chaired a committee that we did last year on, was it improving
The
or
eligibility,
changing?
right. The eligibility application, he served
Thank
in that
you, the
capacity.
eligibility application. And I would second your motion, Bob, if there are no other hands raised. Wayne, are you willing to serve?
Yes, I am. Thank you.
All right. Miss Virginia, can we take a vote?
Sure.
All right.
We have a motion and a second for Wayne Olson as vice chair of the QATF. All in favor, please signify by saying aye.
Aye.
Opposed, say aye. And we have a vice chair. Congratulations, Mr. Olson.
All right, congratulations,
members.
Wayne. We'll move on to our next item. Ms. Trish Whitten will review the proposed TDSP minor updates. Ms. Whitten, you're recognized to present.
Sorry about that. I'm Trish Witten, Senior Planner, Strategic Planning at Lynx. I'm going to go over our Transportation Disadvantaged Service Plan minor update for this year. The plan is prepared by Lynx as the Community Transportation Coordinator in coordination with Metro Plan. It's reviewed and approved by the TDLCB based on a recommendation from this task force. It's also a requirement of the Commission for the Transportation Disadvantage for funding. The major update is every 5 years with minor updates in the interim year. So this one is a minor update, and we are preparing for the major update, which will occur next year. So there are 3 sections, and I know you're probably very familiar with this. The first section is the development plan, and that includes the roles and responsibilities, goals, objectives, the demographics, and the implementation plan. So some of the revisions that we made this year, we updated the signature page, which will be signed after the plan has been approved in May. We also replaced the board roster with the most current roster from February of 2022. We looked at the COVID-related actions in the introduction, and we took out some of the safety measures that were in there last year, and we replaced it with some text stating that Lynx has provided over 1,000 COVID vaccination and testing trips in support of Orange and Osceola County. The next presentation is the Human Services Transportation Plan, so I won't get into that, but we reflected the 2022 update within this document, and that plan will be included as an appendices to this document. We replaced the Lynx organizational charts to show any staffing changes since the last update, as well as the service area map to show any service changes that have occurred. Each year, we look at the local planning documents to make sure that our plan is still consistent with all the other planning efforts out there. And so we made some revisions to reflect the most current transit development plan update that was completed last year, as well as the transportation improvement program, the correct years. The TDLCB certification was also updated to reflect March of 2022. And we took a look at the service area demographics, and we were hoping that census data would be available, but the complete data set was not available at the time that we completed this document. So that will be available next year when we do our major update. So this year we used American Community Survey 2016 to 2020 estimates to look at any changes, and those reflected a small decrease in population and households. I think it was 2% since 2019. We also looked at the Bureau of Economic Business Research projections, and those were consistent, showing, as we presented in the last document, that Osceola County is the fastest growing county in Florida. I think it had almost 45% population increase from 2010 to 2020. And now Florida, this last year, is the second fastest growing state. So we have quite a few visitors moving here. I think Texas was ahead of us as number 1. And we look at the unemployment rate, and this year it had gone down. I think it was 3.8 compared to 6.5 when we did our document last year. So it has gone down, but affordable housing continues to be a problem in our area, affecting the labor force. So we'll continue to look at that in our major update when we have the more current demographic data. Lynx, the Mobility Service Department, each year they pull the major trip generators and attractors so we can see where the majority of the TD trips are going. And consistent with our previous years, the dialysis centers are still the number 1 location for TD trips. So there is a section within the development plan for the forecast of TD population, and that was last updated in our 2020 update, and that will be updated again in the major update with the new demographic data. So the development plan also includes the needs assessment, and last year we had included our general transit feed, which was in testing pilot mode at the time. And that has been completed, where there's data available to show wheelchair accessibility and sidewalk availability at the bus stops. And then also, the Human Services Transportation Plan includes a full needs assessment. And we'll have an opportunity to look at this again next year with the major update when we do public outreach, interviews, and surveys. So this section, the goals, objectives, and strategies were updated to include some status updates. I think the first goal was updated for the Access Plus pilot program, to show that there were just over 900 trips provided each month in that training program, as well as goal number 3 focused on how many days it takes to close out a complaint, and that was just over 10 and a half is the average for the last year. And then the implementation schedule is updated to reflect any changes in the ongoing completion times. And so one of the items had been completed, and that was to put together a standard TD presentation. That brings us to the second part, which is the service plan. And in this plan, we get to take a look at service standards and eligibility. So we did update this section to reflect the new ADA application that was completed to show permanent and continued eligibility now as one of the eligibility for those who are unable to access the fixed route or disability is not likely to improve. So that was added, and that was also added as an appendices to the document. Trip prioritization, each year we look at the number of subscription trips compared to demand response trips. And over the last couple years, subscription trips have been decreasing and demand response has been increasing, and that was the same this year, with 40% of the trips subscription and 60% demand response. We also removed the taxi trips bullet, as Access Links is not doing taxi trips at this time. And we updated the number of vehicles. There were 18 new vehicles purchased over the last year to upgrade the paratransit fleet. And then the tables, table 10 shows the coordination contractors that are coordinating with Links. So any changes to those were updated in table 10. Tables 11 and 12 were the vehicle inventories for NeighborLink and the paratransit vehicles. And then the last item is the System Safety Program certification that Links completes. So we replaced the page with the most current signed certification for the year. And then in table 13, that's when we look at all the service standards. And if there have been any changes over the last year, this is when we would go in and update that table. There were no service standard changes, but we did want to update the call hold time discussion that's been included in that section in previous plans, as we saw quite a big decrease in call hold times last year with the COVID decrease in trips, and it had gone down quite a bit, and we know that this year it's gone up. I think the average was 1 minute and 7 seconds for the year, and I think it's a little bit higher than that now. So that is something that we continue to track and look at ways to improve. Some of the things that Links is doing is offering the web access trip reservation system and the My Access text messaging, as well as looking at new phone system and customer contact software. And we will look at that again in the major update and see where we're at with call hold times. And table 14 is the required CTD rate calculations. So each year, Links has to update the rates for the CTD. And I'm not going to get into that because that is another agenda item that Norm will go over in just a few minutes. And so the third section of the plan is the quality assurance section. And this is when we have the opportunity to look at the evaluations of the CTC, the most recent reviews. And I know that right now, the CTC is being reviewed, it's under evaluation. So what we did this year was leave a placeholder, and then after the May meeting, before we submit the document, we will update that section. But we did review the 2019-2020 evaluation, and there were no significant findings in need of corrective action. And then finally, the last two are the attachments that go in the back. And like I previously mentioned, that's the new ADA application as well as grievance procedures that were updated. I think those were from February 2022 meeting. And those are our changes this year. And I will take any questions that you have.
Are there any questions?
I think I understand, but can you clarify the difference between outside the timeframe, the minor update versus the major update?
Yes, the major update, that's every 5 years, and that has different requirements. So we're required to do public outreach, we're required to update the TD projections, the needs assessment, some of the larger areas of the document, and then each interim year, the minor update, we go in and look at the progress we made towards the goals. So the projections don't have to be updated, we don't have to do the full public outreach process. It's kind of like a self-evaluation each year to see where we are with the implementation program. You're welcome.
Trish, and if I can add on to that, the other thing with the major update, it's done like in between the contracts when they change over. So right now, there's an RFP that's out on the street, and a new contractor, or maybe, well, depending on the outcome of the process, there will be, the process kind of starts all over again. So it starts with the major portion of that update being presented, along with the new contractor.
And we'll have opportunities for this board to be included in that update, for sure. Thank you very much.
Any other questions or comments? Lisa or Miss Virginia, I'm having trouble hearing.
Okay.
I don't know whether
Can we-
it's just
do we
me,
have
but having a little
The
trouble
ability to
hearing.
turn the speakers up.
Are there any other questions or comments?
There are not, Madam Chair.
All right, then, are you ready to make a motion if, you're pleased with the material that was provided?
This does require a motion, members.
I'll move to accept this.
Nika Berry, I second.
Okay, it's been moved and seconded.
Yes.
All those in favor?
Aye.
Aye, opposed? All right, very good, motion carries. Thank you
you.
very much. Okay, next, we will hear from Lynx again, who will present the draft Human Services Transportation Disadvantage Plan, Service Plan.
And Madam Chair, this is where we had the casting change, so it's Ms. Laura Menz is making the presentation on behalf of Lynx.
Thank you, Ms. Laura.
Good morning, everyone.
Good morning.
So we were tasked by Lynx to update the existing Human Services Transportation Plan. We wanted to go over the update methodology. We looked at a demographic analysis and needs from a public stakeholder outreach process. It was very condensed this year, just due to various circumstances, but we updated much similarly to the update of the Transportation Disadvantage Service Plan. We were waiting on updates to the census. So we were looking at the 2019-2020 American Community Survey estimates to update the estimates that had been in the demographic analysis from the previous plan. We looked at existing services available throughout the region, both provided by Lynx as well as other transportation providers. And then we identified gaps and overlaps in services within the Lynx service area. So an overview of the Section 5310 program, which is meant to serve and enhance mobility for the transportation disadvantaged, including those with disabilities, seniors, and those with a low income within the region. We look at, there's a coordinated transportation plan with the state. Our focus is on seniors and persons with disabilities as well as low income. And we want to, and the purpose of the plan is to enhance mobility by removing barriers and expanding transportation options to those within the community. Links is a local community transportation coordinator, and MetroPlan Orlando is the Disadvantaged Local Coordinating Board, which provides oversight on that program. The chart shows how Access Links provides the complimentary ADA trips, which is provided to individuals that are within 3/4 of a mile of fixed route, and above and beyond 3/4 of a mile fixed route service for those that are transportation disadvantaged and meet the ADA, purposes of the ADA. They also serve to transportation disadvantaged and also coordinate with the other private nonprofit providers and transportation agencies that provide for those that can't use Access Links or our fixed route services. So Links being the designated recipient for Orlando and the Kissimmee urbanized area, they provide programs to improve mobility for seniors and individuals with disabilities. As far as how we measure the effectiveness, as we look at gaps in services filled, actual or estimated annual ridership. We also look at how we've increased or enhanced related to geographic coverage as the area grows. We talked earlier about how Osceola County in particular is the fastest growing county in the state, but also Orange and Seminole have also been growing. We look at service quality and service times. Other measures are looking at additions or changes to physical infrastructure within the community, technology, as well as vehicles. In terms of existing transportation services, Links provides 68 bus routes. They also provide 3 bus rapid transit routes or limo. They have 3 fast link routes, which are express routes that have limited stop service. The Neighbor Link is a flexible service. There are 12 routes currently within the Link service area that provide needed service to a lot of areas that are a little bit on the rural side or don't have as good access to Link's fixed route services. This has been one of the efforts we had was to look at the funding that is done on some Links, Neighbor Link routes using 5310 funds to reach some of the targeted groups. And we found that has been quite successful. And it also relieves the pressure and the demands on Access Link services for paratransit. There are 6 routes to Disney that are partially funded by Disney. There's the Paratransit Access Link service van pool, and there are 25 community transportation coordinator providers, contract providers in the region. Part of our review was also to look at the various existing plans and programs, including the minor update to the TDSP from last year, the 2018 to 2027 Transit Development Plan, minor update and major updates that had happened since the 2019 HST, Human Services Transportation Plan update. And then we also looked at the Commission for Transportation Disadvantage Annual Operating Report to look for some of the data that would help us identify those measures that we were intending to look at. We also completed a best practice and peer review. We wanted to look at those peers that are similar to Links and have similar programming or maybe regional demographics or perhaps that they provide some sort of unique or innovative practice that could be adopted by Links. We had 3 selected for Florida, which included Broward County Transit, the Jacksonville Transportation Authority, and the Miami-Dade Transit in Miami, Florida. Our out-of-state peers were Kansas City Area Transportation Authority and Madison Metro in Wisconsin. Some of the key findings we found is that there's been a move toward technology solutions to improve coordination among various providers. Also, to be honest, a lot of the innovations that are being done or some of the best practices throughout the country are already being done here by Links and by Access Links. There is definitely a movement to improve technology, especially in terms of communication with Access Links customers and other transportation disadvantaged people. Software, so those key findings were on-demand information and real-time data. That seems to be a consistent theme in our even in our public involvement outreach, as well as our outreach to our peers. And then also the software interface or improvements to scheduling software and phone systems, which we talked about in the previous presentation. In terms of existing conditions, in terms of adults over 65, the general average is, in Florida is 20.9%, almost 21%. Poinciana in our service area has it has 37.3, nearly 40% of their population is over 65. Other areas that had significant population in the 65 and over population were Winter Park, Maitland, Altamont Springs, Colonial Drive, and also Zellwood in northwest Orange County. In terms of individuals with disabilities, there's 13.5% in Florida. In Orange County, our concentrations tended to be in Orlo Vista, as well as downtown Orlando, west of I-4, in the Paramore, Callahan neighborhoods. Also, we had 13% in Kissimmee and St. Cloud. And then in Sanford, there is a concentration of 11% of disabilities. And we did this analysis based on census blocks. In terms of lower income, Florida has 8.7% of the population is considered to be low income. Orange, Osceola exceed that by a little bit over 1%, nearly 1%. As I said, East Pine Hills is 45% is considered low income, and the Paramore and Callahan neighborhoods are also concentrations of low income persons. In terms of veterans, the Florida percent is 6.5%. Downtown Sanford has one of the higher concentrations of veterans at almost 14%. Other areas would be East Colonial near the Executive Airport, Zellwood in Northwest Orange, and Conway in Central Orange County. In terms of major employment, most are within proximity to some type of LINKS public transportation service. Compared to 2017 data, there was a decrease in employment, mostly in the entertainment and tourism industry. Obviously, that is starting to pick up as we are coming out of the pandemic and returning back to normal tourist levels. But there was also an increase in healthcare employers and jobs within the region. And we have some emerging activity centers in Lake Nona and Horizons West, continuing to expand our urban areas into some of the edges of our downtown core and our main and urban service areas. We also looked at activity centers. You see on the map, I know it's small, but the maps are larger in the document itself. We had identified various community activity centers that would be like hospitals, community centers, particularly seniors, and universities and schools, higher education. In terms of identifying those areas that had limited or no transit options, they were primarily occurred in areas that were on the edges of the urbanized area, or just didn't happen to be outside of a quarter mile or half mile distance to a fixed route. So those sites were identified were Osceola County Council on Aging, Southport Community Center, Renaissance, Castleberry, Claricona in West Orange County, also the East Orange County Community Center, Lake Nona, and Horizons West. Mostly in Lake Nona and Horizons West, we identified the VA and Nemours Children's Hospital and the new hospital that had opened in Horizons West. In terms of public outreach, we had several options that we did. We held 2 stakeholder meetings to work with various transportation providers, folks, agencies, as well as nonprofit groups. We did a NeighborLink survey where we rode 8 routes that were funded with 5310 funds to determine their status, what their satisfaction with the survey, where they identified them as if they were transportation disadvantaged, and also the types of trips that they took. We also did a very brief Access Link survey online where we sampled some residents that were Access Links customers by zip codes, especially in those zip code areas that we had identified as having high populations of transportation disadvantaged, seniors, disabled, and low income. We also conducted several interviews with some of the transportation providers in the CTCs, as well as agencies that have customers that use access links or need transportation services because they serve the transportation disadvantaged community. And then we also reviewed the annual TDLCB meeting that had occurred in November to, there was quite a few comments there. There was a lot of information. A lot of people participated. We wanted to reach out to the people that use the system and hear from the people that use the system. So what we've shown here is where we had the requests in terms of stakeholders. Similar to the last update in 2019, they still are very much looking for replacement vehicles and capital assistance. Access to training, cost of service, safety and security seem to be an issue primarily for the users of the system. Availability of service for nights and weekends was across the board, something that was highly desired and mentioned several times. Accessible applications that people can use to communicate better with the system and understand when their trip is arriving, if their trip is delayed, and making sure that they're updated in a real-time manner. And then access to healthcare was also the leading need for most of the customers that use the system. We assessed the service needs in terms of demographic characteristics and areas of concentration. And we identified places and areas within the community that had some gaps. And we classified them whether they were elderly, disabled population, veterans, low income, or minority populations that were affected in terms of location. So as you can see, we had areas throughout the region. And there's more detail in the report that talks about options to help close those gaps. And we also identified where we made progress in closing some of those gaps from the last report. In terms of gaps and needs, we focused on areas with limited transportation service available to those regions and throughout the community. And then recent developing areas, this is a summary of recent developing areas like Nona and Horizons West. They currently have somewhat limited transit services, but obviously they are likely being addressed in the new upcoming plans and updates, I'm sure. In terms of the action plan, these are a summary. These aren't the detailed recommendations that are contained in the plan, but they cover three basic areas: external outreach and marketing, education and training, and coordinated planning. The Links website, we had identified several inconsistencies where they had outdated information. I think that I noticed there's been a lot of recent changes, and so we just need to make sure that the Links website is updated regularly. I went back and looked today, and the information was correct. So some 5310 program onboarding, we had heard from various users that they didn't know how they should act, what they need to do to get on, to use the system. And I think they've already started with the Access Plus program where they do some training. I think that's very helpful. And then some Mobility Week promotion to promote the services that the 5310 program, how it serves people, how people have options if they are transportation disadvantaged. In terms of education and training, just continuing to do professional development and training workshops for staff, training program for the users of the system, and annual sensitivity training. We just need to continue to make sure that our operators are briefed and continue to understand their customers and how to best serve them. In terms of coordinated planning, there's a lot that's already happening, so continuing to do that. Look for grant opportunities to fund more innovations. Semi-annual meetings of subrecipient agencies would be helpful in informing those subrecipients on the use of the funds and the 5310 program to possibly look for new programming, new fund sources, or other better ways to coordinate, including fund braiding, which is a relatively new It's a relatively new process that allows the use of local funds with other federal programs to make the match. So looking for opportunities to do that. We also suggested bi-monthly or quarterly meetings and some additional progress tracking. And that concludes my presentation. Are there any other questions?
And Madam Chairman, before you go to questions, I'd just like to remind the QATF that this document was sent out to you 3 weeks ahead of this meeting because we had 2 very large documents that were going to be presented to you, this one and the previous report. So just to remind you that this was sent to you via link for you to review ahead of time. And I hope you took the time to review it and that you have tons of questions for Laura.
Thanks.
Are there any comments or questions?
I have a question.
Yes?
Adam Zabritsky. Okay, the 25 CTC providers, are those your subcontractors? You mentioned 25 CTC providers in the area, but then you say Lynx is a CTC provider for the Tri-County
Correct.
region. So they're the subcontractors to you?
Correct.
Okay. And then the NeighborLink, to understand that, I guess I'm putting it together. You have 68 fixed routes, but
Correct.
then there are some areas that are not really served by a fixed route on the links. But there's also kind of a need, I guess they would go into the almost access links basket if they didn't have the NeighborLink.
Correct.
So then to reduce the dependence on that, the NeighborLink kind of gives them an option to almost be on a fixed route, but not needing a fixed route because there's not quite enough volume, but there is a need.
Correct. And the other thing that the NeighborLink does is it provides, it's anybody who lives within that service area can ride it, and they pay the same fare as you would on fixed route. Then it also connects them to our major fixed route service. So it's especially effective in places like Poinciana and Bithlo, and Pine Hills, as well as Ocoee and Winter Garden, those areas that are have a high concentration of transportation disadvantage, but also live in suburban areas that are not within 3/4 of a mile of a fixed route.
So the NeighborLink is for the transportation disadvantaged?
They use some funding to support the operation of the NeighborLink.
Okay, but not all the riders are necessarily
Correct.
TD? Okay.
Correct.
Anybody could ride it? Okay. Thank you, thank you.
Any other
Good question.
comments or questions?
Yeah, just to piggyback on what Adam said, just
Bob, can you please turn your mic on?
if I could reach it out.
Somebody please help.
Either one.
Thank you.
Do bus passes work to pay for NeighborLink? Like if you have a monthly bus pass, can you use that for NeighborLink?
Absolutely, yep. So it's the same fares, all the passes work, it's identical.
The Advantage program is also accepted on there too, so people can pay a fare if they're eligible.
All right, thank you. That was good, thank you.
I have a question. I don't know whether it's yours or whether it's Tish's, but how do you anticipate the hybrid workforce that we're seeing now impacting our TD work trips?
I guess ideally it may reduce the number of TD work trips.
You would think.
You would think.
Yes. That would be what I would think.
And we are seeing a decrease in ridership since obviously from the COVID pandemic. However, that we are seeing an uptick in ridership, and I know that Access Link is also seeing an uptick in ridership as well. But I don't know that we're at pre-pandemic levels just yet.
Any other comments or questions?
My question is regarding the surveys. Do you know how many were sent out and the percentage of compliance or those that came back?
Unfortunately, we sent We did not get a very good response on the Access Link surveys. It would be ideal if we could continue that outreach. We sent out, I believe, almost 1,000 surveys by email, but we only received a handful back,
What, you know, what?
about 2
handful?
dozen.
Said
For
2
the
dozen?
Did
you say 2 dozen? Okay.
For Access Link, for the NeighborLink survey, we did those in person by writing the service, and we conducted surveys on board the buses, and we had a better response rate. There were 8 routes, NeighborLink routes that are subsidized with 5310 funds, and so those are the ones that we focused on. And our Access Link survey also focused on those zip codes that were served by those NeighborLink routes, as well as zip codes folks that lived in zip codes where we had concentrations of seniors and disabled persons. Excuse me. And we had we had 10, our goal was to complete 10 surveys per route that we rode, and that's what we were able, so we ended up with over 80 surveys on the on the NeighborLink survey.
And then only 24 out of 1,000?
Correct.
Wow, that's very low return rate, okay.
Any more comments or questions?
Yeah, how are the surveys sent out?
They were sent via email and with follow-up, so I would suspect that a lot of them just didn't have a chance to respond, and we only kept it open for about 10 days.
Okay. Yeah, we find sometimes where I am, the surveys, we do these online surveys, and sometimes I'm like, but we're only talking to the people that have the technology capabilities, computer access and all that. What about the opinions of those who don't have those capabilities, or their emails filtering it out for some reason, or they just don't check it very often? That might get the numbers up a little more.
And by and large, this population is not good at advocating for themselves, whether they don't have the physical, cognitive abilities, or they just don't have the inner strength. When they see an email like that, it's too much work or another thing on their list to do that they'd like to do that they just don't get done.
Well, Bob, I guess that's why we have to try to impress upon our clients and colleagues and associates that when we do see these surveys, if they can give input, we need it.
Oh, without a doubt.
Yeah,
Without a
maybe
doubt.
we've got to do a better job at that. Anything else for the good of the order?
Madam Chair, if I can ask a question, since we're
Yes.
talking about the surveys. Laura, were any of the 25 CTC providers included in terms of, not the provider, but the clients that ride their service? Were they included in the survey? Is that maybe another arm that we could extend during
think
the
that-
next go-round?
And there probably were clients that were included in that survey, but not that we specifically identified as a customer of a CTC provider. We did conduct interviews with some of those agencies that had clients, just so that we could get a better handle on the needs of their clients and what they're seeing among their clients. It has definitely been, it's a challenge to do the outreach, and especially during COVID-19, we were still under some CDC, recommendations. And I sense that there were a lot of people that didn't use the service because of COVID-19 and found other ways to meet their needs. But yes, I think that's probably one option, and also time, the ability to be able to do more extensive public outreach and get that feedback. We did talk to a lot of the CTC providers, especially those subrecipients that for their clients, they can't, Access Links is not appropriate for them for whatever reason, and obviously they can't ride fixed route as well, so they provide the transportation for their clients, especially at group homes or those that are severely disabled or have other issues that preclude them from being able to use Access Links. They were very active and vocal with in the stakeholder meetings, and we also interviewed several, including the Lighthouse for the Blind, to get a better handle on, because we knew we weren't going to get, we knew we weren't getting good response rates, so we were trying to at least reach out to those agencies that serve those clientele. Any other questions? And we'll be back in May to do for the whole board, so. Thank you very much for your time.
All right. Members, are you ready to vote on the recommendation for the draft Human Services Transportation? Let me start again. On the recommendation of the draft Human Services Transportation Plan that we just received a presentation on. Is there a motion? If so, please unmute yourself and state the motion.
I'll make the motion.
Thank you, Bob. Is there a second?
I'll second.
Madam Chair, we just need to clarify what your motion is. Is it
I'm sorry.
to recommend approval?
I'm recommending approval.
Okay.
Let me go back, Bob. Bob, are you recommending approval of the draft Human Services Transportation Plan?
Yes, I am making a motion to approve the service plan.
All right. And Wayne, you likewise? All right. Any more discussion? All those in favor, please signify by saying aye.
Aye.
Aye. Any opposed? Okay, our next item is a review and recommendation of the rate calculation worksheet. And Ms. Whitten, you're up again, I believe? No, it's Norm. Okay, I'm sorry.
No, she chickened out, so.
Oh, all right.
So we'll no, I'm just teasing her. So she walked down the hallway and went, good, you're here. I don't have to do it. So anyways, if you could put up on the screen, I think there's a chart there. Very briefly, just to show you these are the annual rate calculations that have to get submitted and approved by the Commission for Transportation Disadvantaged. Has to go through their review, and then it comes back and it goes in front of the Quality Assurance Task Force, and then ultimately to the Transportation Disadvantaged Local Coordinating Board. And it's not really an easy thing to put together. There's quite an extensive worksheet that the state requires us to go fill out. You make a lot of some assumptions as to revenues and the number of trips, but you also go back and look at your previous year's expenditures and how much revenues actually did come in. All those things are put into a rate calculation sheet, and then it comes out with the rates. And the good news is, though, you can see a 0.04% decrease in the rates from what they were last year. So they went from, like for ambulatory, from $41.94 down to $40.90, and then wheelchair trips from $71.90 down to $70.11. So again, it is for your consideration and review and any questions you might have. But a lot of work goes into it by our finance team to come up with these rates, and it's using the state's mandatory rate calculation sheet. So for your consideration and review and approval, please.
All right, any comments, questions? If so, state your name and question.
I have a question, Mrs. Wayne.
Yes, Vice Chairperson Olson.
Who actually pays this rate?
Who actually pays that rate? That is the rate to perform the service. So obviously the funding sources, the counties, we get the trip and equipment grant from the state of Florida, and so the combination between the state and the local funding sources are who pay for the actual rates of these trips.
and that money doesn't come out of the pocket of most of the riders.
None of the
Other than our
none of the
taxes.
riders actually see this
Okay.
rate. Yes, that is correct. So you're looking at, what, $4 for or $7 on or not, excuse me, that's ADA, but it could be $2.50, $3.50, or I believe it's $5. So, yeah, that's the most you'd ever see a rider have to pay.
So the point is, as I mentioned during the orientation that I had with our newest members, I wanted to make sure that they saw these numbers, because the rider is paying a significantly reduced fare, and the majority of it is borne to Trip and Equipment Grant and to our funding partners if it exceeds that.
That is correct.
The Orange
And-
County, Osceola.
And quite frankly, due to the, the gracious attitude of our funding partners in the county of, Orange County and Seminole and Osceola, if it wasn't for them, I mean, even the state now is really getting a lot stricter on how much money they're providing. Virginia and I been on countless different meetings, and we're seeing less coming into this area based on new calculations. So the local funding partners are going to have to take on a lot more of the financial responsibility if the trend continues.
Well, as one of the riders who uses the program, I'm very grateful for the local funding partners,
Amen.
especially Orange County.
Amen. So
Yes.
they're
Any
very
other-
gracious and very considerate what they're funding for these programs.
And it is needed.
Yeah,
It
and Madam
is
Chair, if I can
needed.
add one more thing, it was your advocacy going to see Mayor Demings and the team at Orange County that raised the awareness to the need for TD to be included among those services that he's seeking to expand with this 1-cent sales tax that he's promoting. And so I recall vividly you going to his office and sitting there and saying to him, "Don't forget us." And it made it into all of his talking points.
I wrote a letter to my local county, Orange County Commissioner, urging that she please vote in favor of at least putting the penny sales tax on the agenda and allowing the voters to decide. And I hope that can happen, because we should receive some of those monies, correct, Ms. Virginia? We hope to receive some of those monies?
I believe they will hold true to the promise to increase the service. They're looking at transit overall, and so, yes, and they're going to be having that conversation this afternoon on whether or not to put that item on the ballot in November. So if you have time to watch or stop by, it should make for it a really interesting conversation.
All right. Other comments or questions, anyone?
Mrs. Adams Zabritsky, I have just a brief question, because I find it really interesting that the rates have gone down in both categories. And what are the reasons why we think that happened?
Well, don't know specifically, so I don't want to sound like I'm guessing. The amount of trips in the past year have been lessened due to COVID-19. I think we've gotten better in administering our services in many ways. So, in some cases, I think revenues have gone up. So I think it's a combination of a lot of things. To put, specifically to tell you, sir, this is the reason why, I don't know. But again, the rate calculation sheet is like 6-7 pages long, and you fill in all the variables that you know and make the most informed estimates going forward, and this is what came out. So it was actually good news.
Yeah, at a time when a lot of services have seen their rates increase and costs increase, so that was like
Yes.
interesting.
Yes.
So, thank you.
Couldn't it also be, though, that since there are more riders currently than there were the last 2 years, that it's just more efficient?
Well, I think going forward, looking at the future, that's probably true. But when you go back and you look at what your expenses and what your revenues were in the past year and put those into the formula, it may offset it a little bit. So, I mean, it's good speculation, but I'd hate to
Depends when
speculate.
what numbers you're looking at.
Madam Chair and members, as you go to your vote, I want to inform you all that these rates have been submitted to the Commission for Transportation Disadvantage. They've been reviewed by our regional manager, and he has, our region manager, and he has kind of given his stamp of approval that the numbers are consistent, and so they're ready for your action today. So, Madam Chair, we're ready for a motion.
Any more discussion? Hearing none, I would ask for a motion to approve the recommendation of the rate calculation workshop.
I move that we approve, Nika Berry, I'm sorry, I move that we approve, accept the rate calculation.
Is there a second?
I'll second.
Okay, been moved and seconded that we approve the rate calculation. All those in favor, please say aye.
Aye.
Aye. Opposed? Very good, the motion carries. Now we're on to presentations, and Mr. Norm is still there because he's up to give us, he's next to give us a CTC update. Mr. Hinkling, you're recognized.
Madam Chair, I appreciate that, and everyone, it's a pleasure to give this report. So very briefly, it's not a long report. Hopefully it's informative for you all, though. We'll give a quick overview of where we're at, just kind of what we're experiencing, some of the demand that we're starting to see in the past 3 months, customer service activity, talk a little bit as well about the phone activity, the number of calls coming in, trying to actually answer those calls, and give you an update there, and then ongoing initiatives to improve the service, and then any questions that you have and any dialogue that we'd like to have after this report will be more than welcomed. So as an overview, right now, demand for trips are going up. We see that we're on Monday, Wednesdays, and Fridays, we're seeing it where it's well over 2,000 trips, which that hasn't happened in quite a long time. In some cases, even closer to 2,200 trips on those heavy days. And Monday, Wednesdays, and Fridays have always been the heavy days. We're seeing Tuesdays and Thursdays right at anywhere from 1,800, 1,850 trips, which are starting to go up there too, even though they're a little bit lighter on the volume. Call volume is much higher. A lot of people are still calling for their estimated time of arrivals, their ETAs. And so we're fielding those calls also. Staff challenges have been mitigated, we feel, in many cases. We've talked for a long time during the past year, talking about operator shortages, and we worked with our contractor. We were able to make some wage adjustments and help them with that. And for the most part, we think we've mitigated those. We still have a couple openings in our mobility services reps, and it's just tough when you're in this very favorable labor market for employees. They have a lot of options, and to take phone calls all day long, and sometimes folks are a little frustrated, or they could be, putting tape on boxes or something like that for even more money. Sometimes it's a little tough to go recruit those individuals, but the folks that we do find are very good, and they're doing a great job, and we really do appreciate them being there at Lynx. So, and then we've now transitioned away or from a mask mandatory to a mask optional. Still very supportive if somebody wants to come on a vehicle and they want to wear a mask, then obviously that is great news. That's even good for our operators too, because if they want to continue wearing a mask just to protect themselves and they feel more confident that way, then that is still very much encouraged. So while the federal government has said you don't have to wear one, if folks want to, and we're going to always have masks on our vehicles, and one lessons learned is make sure if somebody wants one, we can provide it for them and be happy to do so. As far as Access Lynx demand, This is a breakdown of, and a comparison from last year, from January, February, March. You know, we're up 4.5% in January. We were up 8 and almost 9% in February as far as the number of trips. And then just last month, we were right at almost 7% up from 42,656 to 45,580 trips. So we're seeing that trend continue. So the demand is getting higher on a consistent basis. This chart here shows, again, January, February, and March. Just kind of breaks it down by TD and ADA, the types of trips. Although they're all treated the same, they're all treated with the same level of priority and responsibility. We just, for our internal records, like to break those down, just so we know, because we also have to reconcile with the state when we bill to the trips and equipment grant. So we've seen a little bit of a reduction in the TD trips. We're watching that to kind of see if that's a continuing trend. Is that go to the question that the chair had about TD trips going back to employment centers, or are they still working in a hybrid type employment situation? I know we're in a hybrid type situation with our call center. As you all recall, our mobility services reps are working in a remote environment, and so that may still have an effect. So we'll be watching that just to see if there's any kind of indication that there's a specific trend, et cetera. So it's then we go into customer service activity. We monitor this in many different ways. We look at the number of calls per agent. In January, it was 56, but in March of this year, it was 63. So each of our mobility services reps are actually fielding more calls. The good news is the average speed of answer has gone down to 1 minute, 33 seconds. From, in February, it was 2 minutes and 15. We've been working very, very hard in training, very hard in having people answer questions and then move on if they possibly can, and we've taken care of the customer. The trips, or excuse me, the number of calls have actually gone up too. From January, it was 41,000, almost 42,000, and then we went to 47,513. And we've lowered, though, the abandoned calls. Those are the calls where someone either hung up because maybe their lunch break is over and they have to go, or they got disconnected for some reason, or they got tired of waiting on hold if they had to be on hold for some period of time. But that went down. So what we want is that the answered calls to go up, we want the abandoned calls to go down. So we're in the right trend on both of those. So we're very pleased and happy with our customer service folks for taking care of that and reacting to the calls. Some ongoing initiatives. We have a new paratransit operating center. We have officially moved in first part of April that we moved into what we call the LOC, Links Operating Center expansion area. That's off of Industrial Boulevard there. It's just north of our facility on the corner of John Young and Princeton. Yes. I'm getting old, Ben, so you got to be there for me, buddy. So, but it's working out very well. Still got a few minor little growing pains that we have to iron out, but all in all, we're all very, very happy with it, and it's a lot cleaner environment than what we had over there at LB McLeod, and for that matter, you know, it just treats the employees a lot better that they have a brand new facility to maintain these vehicles, but then also dispatch the vehicles out of. Operator recruitment continues. We still have classes going on, but we're at the levels and numbers that we need to maintain the service and meet the demand. We are looking at the process to upgrade our trapeze system to a new version or the latest version, which will help us then and even further improve our reservation process, our dispatching and scheduling process. We'll even have much more timely maps on the system so that any major changes that have happened in the Central Florida area, they're actually recorded on the maps, and we're routing our buses in a lot more efficient manner, and also being able to estimate the time of travel in a lot more efficient way so that our drivers are less stressed, but our passengers, more importantly, are less time on the buses getting to where they need to go or get home. And then the My Access tracking system, that has been upgraded. We've done some changes where we hope everybody takes advantages of it. That will actually track your transportation if on MV transportation, our vehicles. It will track it. You can watch it on your phone as the vehicle approaches, and you know exactly when it's going to come to your location. So we're really trying to expand that service so that folks don't feel that they have to wait on hold or hopefully get a hold of a customer service or a mobility services rep to find out where their trip is. They could go and electronically look at it and see exactly where that trip is. So we hope that'll be a big help for everybody. And we're more than happy to do training on that too. So anybody that's a little bit nervous about it, a little concerned, we'd be more than happy to walk them through and train them how to get signed up for that. We are working currently with our partners at MV Transportation on being able to do texting and messaging. And we have identified a group of individuals as test partners. People that we've contacted and said, you know, before we do this for the entire public and all our clients, we want to make sure that you'd be willing to be a part of the test, give us that feedback, see how it works, how comfortable it is for the individuals, make any kind of last changes, etc. And we're going to make it optional for our clients. We know there are individuals out there that don't want to get a text message and or an email or a phone call the night before their trip. They make a trip, they have a trip at 8 o'clock in the morning, they don't necessarily need to get, and they don't want that extra message coming in saying, do you confirm? Are we still good? You know, your trip should be there by 8:10. And if they want to opt out of it, we want to respect that right of those individuals that they don't have to be a part of the system. However, for the ones that do and want to make sure that they're getting their trip confirmed, then we will have a system where if you make a reservation and you're traveling tomorrow, like my mom is, she would get a text message or an email that says, I'll call her mom, you're traveling and you're going to get picked up at 8:30, whatever the time is, and the destination is such and such, and do you confirm the trip? And it's a yes or a no, and etc. And then tomorrow morning, she would also get another message saying, your trip is 10 minutes out or 15 minutes out, whatever we find is the most optimal for our clients that we'll set that standard as we go through this test process, whatever makes more sense. So that allows individuals to see and know that their trip is there, it's coming, they can get prepared for it, so when you get that knock on the door, you're ready to go. Trip negotiations, and this is part of the reservation process. We've been making improvements with our current reservation system that allows more options of times. And when I say a trip negotiation, it really comes down to Norm calls, he wants a trip for tomorrow at 1 o'clock p.m. Well, the system will recognize now that there's like 7 reservations being asked for at 1 o'clock. And that may not be the most effective way of scheduling because you don't want people to be late. So our mobility services reps will now go in and ask for other options. And if you don't have to be at a particular place quite at a particular time, well, when we can put that in. But if you're willing to maybe be a few minutes earlier, we can ask you if you could be willing to take a 12:45 pickup time, or maybe even a 1:15 pickup time. And what that does then is allow for a much better sequencing of our buses and arrival times to different locations and batch those in a much more effective manner, which then will improve our on-time performance, lessen the time that somebody has to be on a bus, and ultimately lessen any kind of aggravations, headaches people have because we're running late, et cetera. So what we're just rolling that out now, in fact, is MV Transportation is sending some folks out to do some training starting today. And so we see that as a big help. And again, I know a lot of individuals, and like I use my mom as an example. She has a doctor's appointment at 9 o'clock. She needs to be there at 9 o'clock. Well, we make that, you got to be there at 9 o'clock. No ifs and in most cases like 8:45. You can't be later than that. But then the system will allow us to negotiate what's the right time to pick her up, to get her there by 8:45, and not necessarily have to be grouped on with, 12 other people that we're trying to cram onto one vehicle. So anyways, we're hoping that that's going to work. We're just starting that process now, so hopefully you will start to experience, those that use the system, you'll start to experience that, or may get asked that question, well, instead of your 1 o'clock pickup time, would you be willing for a 12:45 or maybe even a 12:30, and all depending on what the demand is for that day. And the last item here is a new phone system and customer contact system. We're still working through that. It's been approved, going through the contract negotiations. So ultimately, we will have one which will improve our phone system. And again, I think give everybody a lot more options as what they can do. Ultimately, our goal is to get it to where you can make your reservation over a phone and not have to wait to talk to somebody. So that would be quite a technological leap for us. But I think plenty of us do that now when we're talking like our credit card companies and different agencies. A lot of them have that type of phone system. So that it would be a great thing for our clients, and we feel for Lynx also. So with that, that is my report, and open to any kind of feedback or questions any of you might have.
Questions for Norm? Questions for Norm?
Yes, please, Marilyn. I got a couple things now, if I can remember them all. First of all, I was called twice to kind of help with that uploading of the text message option. I called back twice to a fax machine. So.
Can we get with Bob? We'll follow up with you, Bob, right after
And
this.
then,
Okay.
so I'm willing to help. I want to thank
Thank
Ben and Fedner for pushing my stubborn butt
Thank you.
to get on the My Access. It is, it's great to be able to look and see, or, within 5 minutes when your van's going to come. That being said, I know there are others out there stuck in their ways. Reading it on the Access Links website does not do it justice, in my opinion. If someone, not me because I am not that talented, could do a little YouTube video to put on the website, I think you would entice many more riders to use it once they see how simple it is.
It's a great idea. Well, great idea. So, and that's quite common to use those as training tools. So perfect.
Yeah, I mean, for the individuals out there that are more visual, just seeing another rider use it, I think would attract many more users.
Excellent. Thank you. Appreciate
And there was
that.
something else, but I can't remember, so.
Okay, well, if you
I
do.
apologize.
If you think of it, you can always email him.
Oh, Bob knows how to get a hold of
Yeah,
us.
he's always really good at
We
that,
can
yeah.
attest to the fact that he's not shy, and and he does know how to get a hold of us.
Any other comments or questions for Norm?
I have a
Yes.
question, but I don't know what it is. So just listen to the scenario because it happened. I think it's around accountability, but there was one of the riders, and this was Easter Sunday. The van was about 3 hours late, and I just happened to be. It was at my church, so I'm standing there just talking and entertaining during this time, but. Even though the van was 3 hours late, called, answered the phone, all of that, van is on the way. When the van finally came, they never stopped. They just bypassed. So I had to flag someone down to say, can you catch that van because the rider is here? And then I'm calling at the same time. And that was just extremely concerning because being 3 hours late, church was over a long time prior. He would have been out there by himself for this number of hours. And then they kept, every time they called, and he's not a person that's good with the cell phone. He's like 80, I think 85 or something like that. Not very good with the cell phone, just doesn't. And it just concerned me because he's in a very vulnerable position at this point. Just because of the way the church is made, there wasn't anywhere, even if it started raining. But then for the driver to just never stopped. And we ended up at least 2 miles down the street, catching the driver, someone else in a car, to say, come back because this rider is here. At the same time, I'm on the phone, and I think I held on for about 15 minutes with no response to why this driver had not stopped to pick up this client. So that it concerned me. So I'm just wondering, what type of accountability is there in this situation?
Well, that should have never happened, so we'll just put it right out there.
But it does happen, Norm.
Well, I understand.
And what
and
she's
that-
saying, totally concur with. My sister told me about this incident that you're talking about, so I know what you're saying. Our concern is, Norm, and I've asked this to you all over and over with this, when this happens and there are delays this long, what happens if something happens to that rider while they're waiting? Who is ultimately responsible? If something were to happen to that rider, who is responsible?
I don't
And don't
know.
we think about that when we have somebody who is vulnerable, who is waiting?
Yeah, we do think about that, and, you know, again, like I said, my mom rides the system, so no, I would not want that to happen to anybody, anywhere.
What
Okay.
if they hadn't been there for that gentleman? Thank God, since it was a church,
So
they
what
would
what
not
I'm
leave
gonna
him
have to do,
stranded.
though, is go back and try to get the particulars that you're talking about. You said it happened on Easter Sunday. And if you give me the name and of the client and everything, I need to find out what happened. Okay? Because right away, our dispatch should have recognized that a certain individual didn't get picked up in time. And I need to find out, did they go by? Did somebody claim that they went by? Or that they didn't, you know, I don't know. And I'd hate to speculate all the what-ifs as to why. Did people call off that they shouldn't have called off? Did a vehicle break down? I don't know. But, you know, you give me the information and I'll follow with you, Ms. Berry. I promise
But
you.
what are we going to do about trying to make this better overall? We know about this one because there were quote-unquote witnesses. But I do ask the question,
Well, there's
how
no
do we
excuse
make
for
this
somebody being
better?
3 hours late and not having, you know, I don't know if the gentleman had a phone.
But his age, this whole cell phone thing, that's a challenge. So
Got it.
that's challenged, so he's just expecting to be picked up at that time.
Right.
And just, I think for me, just to see the van, like, hey, it just went that way. And so, like, I need someone quickly so I don't go catch the van because he's here, but the van never stopped.
Well, the only way we can get better, though, is being notified of these things. You know, Madam Chair, you're asking, and these are the ones that we go fix. Was it, you know, was the operator being in error? He or she didn't know where they're at? Were they lost? I just don't know at this time. So I'm going to go find out what's happening and why that would ever take place. There's no good excuse. I'm not going to provide, I would never come back and even try to provide a good excuse for being 3 hours late. It's just, but something happened, and we'll try to see what that sequence was.
And just as Madam Chair has stated, I'm concerned, because I'm sure there may be others, and hopefully it's not, but it's very hard to believe that this was the only incident, and it's concerning. It's very concerning when we think about that population. It's very concerning.
Extremely, yes.
for those of us who are blind, and when we're left waiting for the driver, we're not going to see the drivers going round and round and round. All we're going to eventually know is 2 hours have passed or an hour has passed, and nobody's been there. So
And that's
it
why I'm
is
going to go back.
something-
There's all kinds of recordings as to communications between the driver and the dispatchers. And so there's a lot of things that we're going to go look at to try to see. And, you know, and again, we'll sit down with our contractor and make it very clear they can't have this kind of stuff. This is the first time hearing of this particular incident, and I'm very, very sorry for.
Hopefully, we can move to where this is the exception and not the rule.
Absolutely.
This absolutely,
And we agree.
yeah.
We're not fighting you. I'm standing here taking responsibility for that, and ultimately it is my responsibility. So I'm not shucking the blame or anything like that, but I want to go find out what happened.
Any other comments or concerns or questions?
I have a comment to make and on an observation as well. I'm Charlotte Campbell.
Hi, Charlotte.
I was wondering, I mean, as a regular Access Links user myself, I very often require or request that I be picked up by the UServe provider because I find them very prompt, and usually I get where I'm going quickly and they pick me up, you know. Other than that, when I have to wait on the actual bus itself, they are usually late, you know. They usually pick me up pretty much on time, but coming to fetch me is a different matter. But I was wondering, with the use of the UServe contractors or providers, what training are they given with regard to the clients that they pick up? Because whenever I use the Lynx bus itself, the operators are always very, very mindful of my problem and, you know, my mobility issues. And, but also they're very careful to ask me when I get on the bus to maintain that I am, you know, strapped in properly.
Right.
Whereas I find with the UServe and your other alternative providers, they're not very careful. What training do they receive as regards to the needs of the clients that they pick up? Because very often they come to pick me up. No, you know, nobody ever comes to open the door to make certain. I have problems getting into the car, although I use a cane, and sometimes I might have a bag, and I need somebody to hold the bag while I can hold on to the car to get in, and they sit in their you know, in their position. They don't come around to try and see what help can be given, and I find this a little bit odd. I find that they should be trained that you're dealing with people who probably have a problem, and they need to observe and come to the assistance of the person that they are collecting. And maybe they should come to the door, open the door for you know, I find they lack the training in this area. And I, for one, whenever they come for me, they usually are on time, certainly, but they lack the little service that is, that's very important for the person that they're collecting. Normally, it's a person of age and has a mobility issue or something, and you need somebody to stand at the door to hold the bag while you get yourself into the. So I just find that in your training, I find that is an important feature that should be taught to you, the providers, not necessarily the operators of the bus, but the individuals who come to pick you up from UServe and the other provider that you have. It's just a comment that I'm making and that I find
Thank you.
a
Thank
little
you,
bit
Ms.
difficult,
Carroll.
yes, to.
And it's a very good
Ms.
comment.
Sherman.
And it's one of the things, and we do appreciate the comment. First of all, I'm going to take the good news that the MV drivers and operators are treating you well and take that extra level of care. UServe is a TNC, a transportation network company. All the drivers are independent contractors. So while they go through a minimum set of standards being sensitive, how they act out there, they're not really employees. They're not employees of us, and they're definitely not employees of even the company. They come and go as they please. So, so it's a different type of service. Whereas with our contractor, we have a very strict set of training programs and protocols in what we require them to do, which is a little bit higher because you do have the wheelchair, you do have the ramps, you do have all those, whereas with the UServe, you're getting into more or less just a personal car. So again, no excuse, but it is a different level of relationship between do they have to or they don't, and what we require of our primary contractor, currently
Mr.
MV
Norm.
Transportation.
So that so that we can move on. Are you saying to her then in effect, if you're opting to use YouServe, there is a different level of service that may be provided? And if so, is that communicated to the riders?
Yes, because the level of service is much more, well, you got to be ambulatory and et cetera to be on the YouServe service. Whereas if you need a little extra special help, we would really recommend that you not ride the YouServe service and you take the MV service with all the downfalls. And I know we've been in the past, been late and been kind of overwhelmed and things of that sort because of the driver shortage. But they are employees. They do have to meet a standard every day. Whereas the independent contractor, and we even go through some issues where you might be scheduled for a YouServe and the driver doesn't show up. He or she decides, last night I worked for Uber or Lyft and the basketball game was really good. I made my money for the week. So I'm not going in at 6 o'clock tomorrow morning to go pick up that first ride, and they send it back to us. So it's something that we're very much dealing with. Well, I'm going to bring this up to their management. But again, there is a difference because there's an extensive ADA training that the MV transportation drivers have to go through.
Is this an industry-wide thing where the TNCs, operate a little differently?
Yeah,
Okay.
yeah. Because they're not employees. They're
Okay.
not employees. That's the crux of the issue right there. They are independent contractors. So you may get 5 that just are extraordinarily because they're just good people. And then the other 5, they're doing it just, so, and they don't maybe put the same level that the other 5 do. And that's just, and if I call and say, I want this person out of there, or they're not doing this, I have a standard that I have to meet, and it comes down to drug and alcohol and those kind of safety standards in particular, so. But your
So
point's
that
well
I can
taken.
end our meeting and not have to ask my cohort to continue. Are there any other questions? And Ms. Charlotte, that is an important issue, and we'll hope that they can continue to work on improving that. Okay. Are there any committee members that have any final comments? If so, please unmute yourself. And Norm, we thank you for your report and for your work.
Madam Chair, there doesn't
Yes.
seem to be any member comments, but I would like to bring a couple of things again to the attention of this committee. When you were last together, we were in the middle of a legislative session. You were last together in January, but you heard at your February LCB meeting that there was some issues that were arising with the transportation disadvantaged funding, in that there was a difference between what was recommended by the House and the Senate with regard to the budget. The Commission for Transportation Disadvantaged had requested an additional $10 million in budgetary authority. This is money that is already in the coffers. So they were asking to be able to use $4 million of that for the Innovative Service Development Grant and $6 million of that for Trip and Equipment Grant. When everything was presented, the budgets from each side, there was a gaping hole between what one had recommended and the other. Where it all fell out in the wash, the Innovative Service Development Grant was recommended and approved by House and Senate at $4 million, and the Trip and Equipment Grant at $2 million of additional budget authority. So instead of 10, it was brought down to $6 million. It's my understanding that the budget is still awaiting, has not been transmitted to the governor because they were going into special session and they were holding that back as a carrot and a stick, and hopefully soon it will be transmitted over for his signature. But at this time, it is recommended by both House and Senate $4 million for the Innovative Service Development Grant, and $2 million additional for the tripping equipment. Also, I sent out an email to the LCB looking for those who might be interested in attending the annual CTD Conference and Expo in August. And we have filled those available options or opportunities for members who are interested. So I want to say thank you to those who are available to attend and have committed to the entire 2 days, both days of the conference and workshop, Expo. So, Madam Chair, that concludes my final announcements, and we are ready to move to public comments if no one has any questions for me.
All right, we'll wait to hear what is the conclusion with the legislature. It's now time for the second opportunity for public comments on today's agenda. If any member of the public wishes to make comment, please use the raise hand function and you'll be recognized, or dial *9 on your phone keypad. We'll unmute your mic, and after you're recognized, please state your name and address for the record and limit your comment to 2 minutes or less. Are there any comments at this time?
There are no hands online, Madam Chair.
All right. Is there anyone wishing to make a comment who is here in person?
We have not received any comment cards.
All right. Were there any written or phone comments submitted before the meeting?
We did not receive any written or phone comments.
All right. The Transportation Disadvantaged Local Coordinating Board meeting will be held in person on May 12th, 2022, here at MetroPlan Orlando, and the next meeting of the Quality Assurance Task Force is scheduled for July 26th and will also be held here in person. And at this time, if there are no further business, we stand adjourned. Thank you all for your patience online and in person. It's good to be back with everybody and look forward to seeing you again in May. And thank you for the wonderful staff assistance that we always get.
Thank you, Madam Chairman, members.
Meeting adjourned.
Have a great day.
Welcome, sir.